One of the things that makes NAU unique is the high degree of student participation in the laboratory. Our first story examines some of the student research that has healthcare applications.
One of the diseases we work on in our lab right now is called chronic rhinosinusitis. In here you can see an endoscope of a healthy sinus, and you can see that it's fairly opaque. It doesn't look like there's any disease there.
Dr. Jeff Lead and the students in his lab are studying chronic rhinosinusitis, or CRS. It's characterized by inflammation of the sinuses from infection, allergy, or autoimmune issues, and lasting at least 12 weeks.
This is a very important disease. It has a lot of clinical relevance, what we're doing here, because over 16% of the U.S. population suffers from chronic rhinosinusitis, and it costs the U.S. about $6 billion annually in physician visits, surgeries.
Parmenter is studying the immune system as it relates to CRS and how regulating certain genes could affect the immune response.
Right now I'm focusing on Haemophilus influenzae and Streptococcus pneumoniae, and I would like to broaden that because these polymicrobial communities are very important to the disease.
There is still a lot to be learned about chronic rhinosinusitis and how to treat it. Emily Cope's research includes the effects of cigarette smoke on the sinuses and how exposure promotes mucus and leads to increased bacterial colonization.
People already know that smoking is bad. With this research, we can really send a message out to people who are exposed to smoke, why their CRS is so bad.
Cope calls this lab's research on community virulence groundbreaking.
Nobody's ever looked at it before. People think of disease and they think one organism causes one disease, but here we have a disease like chronic rhinosinusitis, which is caused by complex communities of microorganisms.
Cope would like to have her own lab one day where she would continue her research and teach. Parmenter is going into the medical field, possibly as a physician assistant, where she plans to increase communication between researchers and physicians. These graduate students credit Jeff Lead for encouraging their research as undergraduates at Northern Arizona University, an opportunity rarely afforded younger students.
And if you're an undergraduate that wants to go to medical school, to dental school, vet school, or go on to graduate school in biomedical sciences, it's a training that I think really no one beats us at all in the state, and probably anywhere in the Southwest we'd be one of the best schools around for these types of things.
Lead says students learn a lot in the classroom, but their understanding of microbiology, the human immune system, and diseases like chronic rhinosinusitis is much more complete when complemented by work in the lab. Research on these pathogens is ongoing.